briefing, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning are Dr. James Hildreth, President and CEO of Meharry Medical College, and Dr. Julie Gray, Assistant Dean for Student Affairs at Meharry. Chief John Drake of the Metro Nashville Police Department and Dr. Gil Wright from the Metro Public Health Department are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Today's COVID-19 report shows progress, slow progress, but progress in Nashville's coronavirus response. Public Health is reporting 144 new cases this morning, bringing Nashville's 14-day new case rolling average down to 181.6. Now, we reported this metric at 190.5 exactly 1 week ago. Nashville is currently at 24.2 per 100,000 residents for our 7-day new case average, down from 28.5 last Thursday. Now remember, our state and country's goal is 10. And our 7-day positivity rate has declined from 13% to 10.8%. Dr. Jahangir will discuss these numbers in more detail. In the earlier phases of coronavirus, demand for coronavirus tests was greater than capacity all across the United States. And with this sudden demand also came delays in test results. Now, the delay could have been improved with a federal coordination and a national testing strategy. Simply put, there were not enough tests and the test results were late in getting reported out. Now, in the United States, the average daily number of tests between the end of July and the beginning of August has dropped by 18%. In Tennessee, during this time, tests have dropped by 23%, and in Nashville, 41%. Now, this drop in demand for tests here and across the nation is a concern, but it is also an opportunity. It has allowed the system to catch up. Response time and reporting results has sharply improved. And Nashville now has both the testing capacity and the quick turnaround times, so that testing can be used as was intended as a proactive tool to keep our residents safe. Businesses can use free testing at our assessment centers as part of their employee safety regime to keep both their staff and customers healthy. We can use testing to get ahead of disease and be proactively safe. Testing can build confidence and help us reopen the economy safely, but we must use it. As we've previously reported, there are no lines at Metro's 3 community assessment centers, which for the last 3 weeks now have provided test results within 48 hours. Along with masks and proper social distancing, substantial testing is vital to fighting this public health crisis. Our assessment centers are ready and waiting to provide free diagnostic tests to all Davidson County residents. And this morning, I am pleased to welcome Dr. Julie Gray, Assistant Dean for Student Affairs at Meharry Medical College. And Dr. Gray is helping to supervise the Meharry student clinicians who are staffing our assessment centers. And she's here today to provide an update on the operation of Metro's testing sites. And I'd also like to welcome Dr. James Hildreth, President and CEO of Meharry Medical College. And Dr. Hildreth's service on the Metro Coronavirus Task Force has been critical. And I'm deeply grateful for both his expertise and ongoing guidance as we work to keep our city safe. Remember, Nashville, don't share your air. Always wear a mask or other face coverings in public places. Keep 6 feet of distance between yourself and others. And visit covid19.nashville.gov to learn more about how you can avoid both getting and spreading COVID-19. Now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper. This morning, we are reporting the new cases per 100,000 residents is improving. The new cases per 100,000 is the 7-day average that allows us to compare how Davidson County is doing to other counties and other states. Today's report of 24.2 new cases per 100,000 residents is still slightly higher than our surrounding counties. However, in the state, Davidson County is trending better than 32 other counties. Being under 25 new cases per 100,000 gets Davidson County off of the national hot list. We are trending in the right direction, and ideally, we need to get this number below 10. That will allow Davidson County residents who have loved ones in nursing homes to visit those loved ones. If our state gets below 10, it allows us to be taken off a lot of the travel restrictions that we've been placed on as a state. This week, Davidson County surpassed the 200,000 test mark. When you look back at where we were in March, you realize this is a major milestone for our city. When the Metro Coronavirus Task Force was formed, getting access to a test was a top priority. On March 31st, Vanderbilt University Medical Center, HCA TriStar, St. Thomas Ascension, Nashville General Hospital, and Meharry Medical College all came together to open our community assessment centers to provide testing to our residents at no cost. Since then, these centers have administered more than 88,000 tests, or 43% of all the tests conducted in our city. I'm very thankful to all those who have and continue to work at these centers. Dr. Julia Gray is here with us this morning. I appreciate her work, as well as Amber Duventry and all that the Meharry team has done in conjunction with the task force to make sure ease of availability of tests. I can speak on behalf of the mayor and the entire task force when I say you should be really proud of the work you've done, and I know we are all very proud of you. You are genuine frontline heroes in this city's fight against COVID-19. Over the past 5 months, we have expanded COVID testing capacity from nearly 0 to more than 10,000 per week. Now in Nashville, COVID tests are still easily available. Our assessment centers are efficient and effective, and they are delivering the testing our residents need. So please don't be hesitant to get tested if you feel that you need to. The COVID assessment and information hotline is also still open, and that's something that we also established in March. As a reminder, that phone number is 862-7777. Again, 615-862-7777. You can call and speak with a medical professional who can guide you if you have any concerns around COVID-19. The hotline is open 7 days a week from 7 a.m. to 7 p.m. So please, if you have any concerns about the virus, call our hotline or go to one of our assessment centers. This morning, the metrics are trending in the right direction. However, we have seen this before, and this could change quickly if we let our guard down. So please continue what you're doing. Stay at home if possible. If you go out, stay apart, wear a mask, and remember to wash your hands frequently. The virus is not going to go away on its own, and we must focus to keep it going down in our city until we have a permanent solution and a vaccine. I now would like to introduce Dr. James Hildreth.
Good morning, Nashville. Today, I'd like to share some more good news from multiple research teams that have been studying the immune responses to people infected with the SARS-CoV-2 virus, the virus that causes COVID-19. But first, I need to describe two important concepts to help you understand how the immune system works. The first is what we call clonal selection. Our immune system is capable of responding to billions of different molecules on viruses, bacteria, and other things. It's quite extraordinary, the number of things that can be recognized. The way this works is we have cells in our bodies called clones. Each of those clones, and there are billions of them, have recognition capacity for individual molecules, and that gives us the ability to respond to so many things. When we get infected by a virus or bacteria or other microbe, the clones that can recognize those viruses get activated, they expand, and now that clone becomes a small army of cells designed to fight off that invader. So the result can be a collection of armies of cells, each derived from a single cell that we call a clone. And this is referred to as clonal expansion. When the virus is eliminated, something remarkable happens. Almost all of those cells commit suicide, literally commit suicide, and disappear from our system. But a few of the cells remain in our bodies. They go into a quiescent state, and they're called memory cells. But these cells retain the capacity to respond to that consult the next time you see it. That's why they're called memory cells. And what that means is that the next time you see that virus or bacteria, you can generate these small armies of cells to fight it off very quickly. So the generation of memory cells generally means that we've had a strong and what's really important, durable response to an invader. So in a recent study published by multiple investigators at different institutions, they have studied the immune response in asymptomatic individuals, people who live with folks with COVID-19, and those who've had mild and severe disease. What they found is, and perhaps most surprisingly, is that in those that have been exposed to the virus, those that have been infected with the virus and recovered, all of them have memory T cells in their systems capable of responding to COVID-19 virus, SARS-CoV-2. They also have memory B cells. These are the cells that make antibodies that can neutralize COVID-19 virus. So this observation provides strong support for the idea that when you get COVID-19, your body generates memory cells, and when you see the virus again, it's very likely that response will limit disease and keep you from getting a recurrent infection. And since memory cells are critical to successful development of a vaccine, this is yet another example of some news that makes us convinced that there will be a vaccine to COVID-19 and that that vaccine will be effective, because we've seen that in people infected with the virus, they make a durable response that includes memory cells. So if the right vaccine candidate is chosen, we can be pretty confident that that vaccine will probably work. And I think that by this time next year, there might be as many as 3 vaccines have been approved for use in humans, for use in the population. And while we're on the subject of vaccines, let me take this opportunity to urge everyone 6 months old or older to get a flu shot. People at high risk for severe influenza disease are especially encouraged to get the shot. As it turns out, it's the same group of people who are likely to get severe COVID-19 disease. If you have diabetes, if you're 65 years of age or older, if you have heart disease, or you have any condition that compromises your immune system, you are very likely to get severe disease if you get influenza. So for those individuals in particular, please get a flu shot. Getting vaccinated against influenza this season is probably more important than ever, because it is very likely, almost certain, that this fall, flu viruses will be circulating along with the COVID-19 virus. So the reason why this is so important is it is not unthinkable, in fact, very likely, that some of us get infected by both viruses. Imagine our bodies being challenged by flu as well as COVID-19. The morbidity and mortality in that situation could be quite significant. But more importantly, many thousands of flu patients need to be treated in hospitals, and many of them treated in ICUs. And unfortunately, thousands of people die each year. The point is that if our healthcare system has to deal with large numbers of flu patients and COVID-19 patients, both of whom need to be treated in ICUs, that might be an untenable situation for our healthcare system. So for that reason, of protecting our healthcare infrastructure from being overrun, protecting your own health, I strongly encourage all of you to get a flu vaccine this season. And some of the myths that you know about flu are just myths, the flu vaccines. First of all, they're very safe. Every component in the vaccine has been evaluated for safety in humans. They do not cause flu. There are no viruses in the vaccine that are capable of doing that. The other thing is that the vaccine only lasts for 1 season. Unlike measles, diphtheria, and rubella, those vaccines give you protection for life. The flu vaccine only protects you for several months, which is why we ask you each season to get a flu vaccine. Also, the flu vaccine that circulates each year can be slightly different from previous years. That's why we have to get a new shot every year. So for all of those reasons, I really encourage all of us to get a flu vaccine to protect our own health, but also to keep the healthcare system from being overrun. So Nashville, as you heard from Dr. Jahangir, we're on a really good trajectory of driving the virus out of our community. The transmission rate is now 0.89%. The percent positive test has gone back down to 10%. The one number we still need to work on is the number of cases per 100,000 population. That needs to be below 10. If we get that number below 10, it will be safe to do a lot of things that we're not allowed to do right now. So let's keep it up, Nashville. We got this. Please wear a face covering when you're outside. Wash your hands frequently. Protect your T-zone. Do the social distancing. If we do all of those things, we can get back to a new normal sooner rather than later. So with that, I'd like to introduce my colleague and a superstar at Meharry Medical College, Dr. Julie Gray, who's an assistant dean in the School of Dentistry. Thank you.
Thank you, President Hildreth, for those kind words. Good morning, Nashville. In addition to my role at Meharry Medical College, I also serve the great city of Nashville as a site leader at the Nissan Stadium for the COVID-19 Community Assessment Center. I'd like to say that I'm very happy to be with you today to share some very important news on getting tested for COVID-19. The fight to slow the spread of the virus is far, far from over. We are still in the midst of a global pandemic, and testing remains just as important today as it was 4 months ago when we began our testing. Getting tested has a far larger impact on our lives than we can even imagine. Comprehensive testing, like we have here in Nashville, is the only way to know where the virus is throughout our city. Sure, we get tested to protect and care for ourselves, but we also do it for our community's collective health. If we can all continue to work together to practice social distancing measures, wear our face masks, wash our hands diligently, and get tested, we increase our chances of getting back to our regular routines. Additionally, Nashville, I want to encourage each of you to remember that it's often important and very necessary to get tested more than once. If you've been tested once this summer and are unsure of your status today, I encourage you to get tested again. If you encounter a large group with or without a face mask, please get tested. If you're around someone who is COVID-19 positive or who has been exposed to the virus and is unsure of their status, please get tested. To get tested, it's very simple. Come to our community assessment centers. They're located on Meharry Medical College's campus, Nissan Stadium, Lot N, also at the Kmart, the former Kmart, on Murfreesboro Pike. We are always there Monday through Friday, 7 to 1 p.m. All of this testing is done free of charge. We appreciate you, Nashville, and your commitment to helping to fight the spread of COVID-19. Your community effort is saving lives, and we need you. Let's continue in this battle together to improve the well-being for all humankind. As I say to my team every morning in our morning huddle, be kind, do good, and love all. Testing is our way to make sure that we achieve this. Thank you, Nashville.
Thank you, Dr. Gray. We'll now begin taking media questions. We have 2 questions this morning. The first is from Nancy Amons at WSMV.
Hi, thank you. The mayor was talking at the very beginning about encouraging, I believe he was saying, advocating that businesses have their employees tested. Can you clarify that? And also, I think it would be kind of a strain on a business who wants to get a lot of employees tested if they then have to quarantine and can't go to work. Can you also clarify what your community outreach testing is now? Are you still sending out mobile labs to do testing? But the biggest question is about the testing in the workplace.
Thank you, Nancy. Mayor Cooper, I want to see your first question, and then we'll have someone from Public Health to talk about the mobile testing outreach. Mayor Cooper.
Thank you, Nancy, for that question, and I'll get Dr. Jahanger to comment on this as well. I think finally we've built the capacity in the system and the response times for testing to be effective. I understand the natural reluctance for being tested and results, but we have to get through that. Businesses need to work with our assessment centers and build a regime where you can use testing, particularly for our front-facing employees, to make sure that they're safe. This is going to help build confidence so that we can restart the community and we can help drive the disease level down. Now, it's people's civic responsibility that if they are positive or fear that they are positive, that they need to quarantine. Now, testing will relieve fears also by knowing that you were negative. And so it works in that direction, and it's an opportunity, and it's a responsibility of all of us. If we think we have the disease, or certainly if you have the symptoms, there's no excuse for not being tested. And then again, the response times are now, we're able to limit the risk that the community accepts. At one point, if response times were 10 days, then the effectiveness of testing could sharply be brought into question. But today, I think we've gotten it to where we always wanted it to be, with the help of our great partners at Meharry, which is a tool for dealing with the disease and actually driving the infection or the spread rate down. And then here's Dr. Jahanger on your second part of your question. Or Dr. Wright. Thank you.
Good morning. We are doing mobile testing. We have a team that is dedicated to doing nothing but mobile testing within the community. They test anywhere from one to several sites on each individual day. They do testing on weekends and just wherever we need that testing to occur, particularly in our hotspot areas. There's additional testing that the state sets up. And in the past, Meharry has had some testing that they've coordinated. All of us are coordinating those with community-based organizations and churches and others that have been identified as places that want and need the testing to be done.
Kathleen Surrey at Fox 17.
Good morning. Thanks for taking our questions. Can the mayor provide a comment or a response to the botched police raid that happened at a Nashville home earlier this week? And can he also talk about the changes outlined by the chief yesterday, and if he thinks those are enough to create a substantial change in the department to make sure this doesn't happen again? Thank you.
I'm sorry. So Chief Drake is actually here, and he's you're referring to the warrant that was served at MDHA, and Chief Drake has some comments to make about that.
Yes, thank you for your question. I do believe there will be substantial change. Firmly in my heart, our approval process for search warrants stopped at the lieutenant level, and sometimes the captain or commander would be advised moving forward, it would be done by the deputy chiefs at the executive level. And so it'll go through, instead of 2 levels, it'll go through 4 different levels of approval. That will ensure that it doesn't happen again. Also, we're calling all those teams in for refresher training, and that training will be ongoing for several months to make sure this doesn't happen again as well. Our teams, this search warrant was through complacent investigations before the search warrant was served. The traditional method of surveillance and identifying fresh evidence wasn't used. And also, this was for a property crime. It was looking for items of evidence, and the force used was just not appropriate. And so all those are being handled. I think this will ensure that we never have this again.
And then if I may, Kathleen, thank you for your question. And very quickly, I want to thank Interim Chief Drake. It's a great thing to be able to admit mistakes, to learn and respond. It's a great thing. We'll need that skill set in all of Nashville going forward in lots of areas. And I'm grateful that the MMPD is reflecting that today.
We have a few minutes remaining. We'll take a question from Blake Farmer at WPLN.
Yeah, I wanted to talk about the excess testing capacity. Is there some way that you all could use this in an effort to reopen metro schools? Has there been discussion about some sort of testing regimen to get schools reopened in the next couple of weeks?
Thanks for your question, Blake. Dr. Jahangir?
Sure. So Blake, maybe I'll even take your statement a little further. I think this extra capacity that's now able that we have, and I want to highlight part of this extra capacity is the number of active cases now is at 2,600, where it was up to 5,000 something a few weeks ago. So less people are actively ill. They're in contact with less. So that means less people are in contact with people who are actively ill. So that's why we have more capacity. I want to highlight that. We're at 10.6, 10.8% for test positivity. So people who need to get tested are getting tested, and now we do have extra capacity. So schools may be one option, one idea. I think the literature on whether to test students back and forth is not fully developed out there, but perhaps other businesses, right? I think as the mayor highlighted and others highlighted, we want to use that capacity. If businesses feel like they need that testing to help open up their businesses, we welcome them to come to us to the sites and use that capacity currently. So hope that answers your question. Thanks, Blake.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth and Dr. Julie Gray for joining us today. Beginning next week, Metro's COVID-19 press briefings will return to a weekly broadcast schedule, airing on Thursday mornings at 9:30 a.m. until further notice. As always, Davidson County residents can continue to access timely COVID-19 information by visiting covid19.nashville.gov. This includes data from Metro Public Health Department. Thank you for joining us. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.